Everybody, it's Dr. Lisa. Welcome to the Grapevine Health Channel, where we try to bring community voice into conversations about health. And today I'm excited. We have Dr. Jasmine Marcelin, who is an infectious disease doctor working at the University of Nebraska Medical Center, and she will answer a few questions I've gotten from the community about COVID-19. In some of these conversations, we also like to invite a community member in to ask questions as well. So this will be a 15-minute or so conversation. I know you're busy, doctor, so we'll jump right in after you guys introduce yourselves. So why don't we start with Tiffany? Tiffany is our community member today. So Tiffany, tell people just quickly a little bit about you.
Hi everyone, my name is Tiffany. I live here in the Washington D.C. area. I work in healthcare and yeah, I work in
Okay.
healthcare.
So I'm assuming you also have some questions for the doc. So we'll
Yes.
get to that in a second. How about you, Dr. Marcel? And I understand you're also an entrepreneur. So shout out to physician entrepreneurs. Tell us a bit about you and your journey.
I am an infectious diseases physician. I'm originally from the Caribbean. I was born on the island of Dominica, and I currently live in Omaha, Nebraska. And I work at University of Nebraska Medical Center. Also a medical educator. I don't know if I would call myself an entrepreneur, but I do like to think about ways that we can innovate within the sphere of medical education and patient communication, advocacy, and community engagement.
So what's one of the coolest things you're doing around education right now?
So right now I am working with a group of folks who have basically redesigned one of our curriculum for our medical students when they come in as first years to include opportunities to really dive deep into themes like healthcare justice, bias, racism in healthcare, and structural determinants of health to really get the students a good background of how they can understand the context that their patients are coming to them with. But what's unique about this curriculum is that we also are taking students into the communities to get to meet community members, to learn about how the individuals within the community interact with the healthcare space so that they can get that firsthand knowledge of how they can be better physicians for their community, and try to see how we can foster communications and connections between medical students and the communities that they serve as soon as they get into medical school.
Yeah, that's so important, especially now we need to do a better job understanding people's circumstances and take that information into our patient care. So
Yeah.
thank you for the work you're doing. I want to jump right in and ask both of you if you've seen this tweet going around, Nicki Minaj saying that a friend of a friend got the COVID-19 vaccine and now his testicles are swollen and he's infertile. Have you all seen that? And what do you think about that?
Yeah, I saw it last night, and I had a lot of thoughts. The first thing that came to mind was, of course, Twitter is, and any kind of social media platform is, especially for an individual who has a large following, a large platform. It can be an opportunity to spread information, but it can also be a great opportunity to have discourse that could potentially be taken out of the context of what the original intent was, right? And so I reflected a little bit on it, and I thought, this was kind of maybe asking a question or posing a comment like she would have to a private WhatsApp group or personal communication, and just trying to talk about it. Some of the issues, some of the potential problems is that while it's asking a question that could be framed in a way where you could have a discourse with a medical professional that could help answer that question, there are misinformation streams that are going to use that question, which could be asked innocently enough, as a means to justify some of the misinformation that is out there. So to just address it, one of the most common reasons why a person's testicles might be swollen is a condition called a hydrocele. And it's what happens when there's a little bit of fluid that can accumulate in within that testicular area and cause enlargement of that scrotal sac. And a lot of times it does not cause any pain, and it's not problematic to the men, the people that are experiencing it, but it can be pretty concerning when you find it there. We don't have a lot of data that shows that that is actually a side effect of the COVID-19 vaccine. That has not been seen. And infertility is something that is a real concern for a lot of us out there. And we want to make sure that we are putting things into our body that is not going to hurt us. And none of the vaccines have been shown to cause infertility in men or women. And so that's a really important point to be able to get out there in response to that tweet.
Yeah, I also think reminding people that one of the most common causes of swollen testicles is actually sexually transmitted infections, like gonorrhea and chlamydia. And sometimes those symptoms can be pretty subtle and people don't go get checked out. So I just want to remind people, if you do notice there's something not quite right down there, go get checked out. What about you, Tiffany? What are folks in your circle saying about this, and what are your thoughts?
So I did actually see the tweet last night too, and I had a chuckle. But my biggest concern was two things. Was one, this is how misinformation gets spread, and particularly within the community when people are very still distrusting of the vaccine, and they are relying on word of mouth in their interactions with their family, their friends, to pass information about what decision they're going to make regarding the vaccine and regarding any COVID precautions that they're going to take as well. The other thing that I know that tweet mentioned was she said she was going to do her research for, she was going to make a decision about her, sort of what to share and what information she would use regarding the getting the vaccine. And, from that perspective, I would say and remind the community that check the sources of the research and the information that you are seeking. If it's Twitter, if it's Instagram, which can also be great platforms for spreading, positive and relevant information and getting it out there quickly. But what is the source? And, that's what I would really pose to a lot of folks. And I did send the information to a couple people last night, and we all sort of have the same agreement that, what's the source of this research that she's going to use? And when you hear that in the community, I'm going to research, well, how can we as community practitioners and even as clinicians point people to resources that they are comfortable with, that are of the appropriate literacy level, but also provide factual information.
And Dr. Jasmine, as a researcher yourself, I'm sure you've heard this too. People say, well, I'm going to do my own research. In fact, I have a colleague who told me his patient told him, well, I'm going to do my research. And when he said to him, well, I can answer any questions for you, I'm familiar with vaccines and COVID-19, he said, no, I'm going to do my own research. But when there's so much misinformation out there, conflicting information, some of it's actually true at its core. And then because it gets transmitted over time, it gets distorted. How do you advise people when they say, well, I'm going to do my own research? What's the most important thing we can convey to people?
So I really liked Tiffany's point about the source, right? Where is the source coming from? And we know that over time there have been differences in how the information has been shared to the public, and it has not been accessible enough for them to feel like this is a source that I can rely on. If we as healthcare professionals, clinicians, researchers only share the peer-reviewed journal articles, that may not be helpful to the folks who are just trying to understand what is the general point. And so being able to distill that down. So I would say looking to your local hospitals. If you are unsure about where to get the information from, your local physician or your local clinician and the hospital that they are affiliated with often does a great job of trying to distill information so that patients can understand it. And then looking to the individual healthcare professionals themselves who may be out there. So if you are typically finding yourself from a social media standpoint on Twitter or on Instagram, there are healthcare professionals who are completely verified experts on what is going on in the pandemic and have done the research and can be able to answer questions. And many of these individuals will answer if you ask a question to them directly. And so rather than relying on things that may be sort of forwarded multiple times through different social media channels, it would be best to go directly to the source of the hospital, the physician, the clinician who will be able to give you that information directly.
Yeah, and I know peeling the onion, it can be difficult because even when you get to the root or the source of the information, you may not be able to get the answer or even get in touch with that person. So I know it's pretty frustrating. So, I really would love to hear both your perspectives on the challenge we're having with trust in the health and science community. I had someone say to me just last week, he says, I'm tired of your charts and I'm tired of you telling me about the research and the data. We just don't trust you all anymore. You've been wrong so many times. How do we get here? And more importantly, what do you think we need to do to fix it? Because if we don't have trust in our health messengers, then we're in a lot of trouble, because I think we need to build that trust so that we can get out of this pandemic. So what are your thoughts? Let's hear from you first, Tiffany, and then you, Dr. Jasmine.
Okay. Yeah, you bring up a really good point regarding trust. People are not only distrustful, they're also tired and fatigued of the last 18 months of also conflicting messages in that time too. I know one of the things in public health, the community health worker model has always been really helpful to try to establish rapport and trust within communities.
What is a community health worker? Can you tell people what that is?
Yeah. So a community health worker is a person who may not necessarily be medically trained, but they are a source of valued, trusted information within a community. So it could be, a grandmother, it can be a barber, it can be the local beauty shop. And that is the person. And with this model, those individuals are sought out, develop relationships between medical systems or community health organizations, and are then utilized for their knowledge that they can help to share within the community. And so, we're sort of building the boat as the waters are rising. So it's not a great time to say like, oh, we need all the community health workers now. But just overall in the infrastructure of medicine, this is what we've seen is, that's something that would be very useful to help disseminate information. And just generally, I having an empathetic ear, understanding people's perspectives instead of just coming at it like, yes, this is what the science says and this is what you're supposed to do. Well, why do you feel this way? Why do you not trust it? And with African Americans, with many communities of color, there's a long history that none of us need to get into because it's well documented, for reasons that people would not be fully trusting of medicine or of the healthcare system of the government. So what do you do other than having a listening ear and continuing to be a reliable, consistent source of information?
Yeah. And Dr. Jasmine, before you answer that, I think there has been a lot of talk about Tuskegee, but what I remind people is that we don't have to reach back, to 40 or 50 years ago to understand why people are distrustful. you can sit in an emergency room today, or you know, be a fly on the wall at a visit and see why people feel disrespected or not listened to. So, what are your thoughts about this trust dilemma we have?
I think it is imperative that healthcare organizations and people who are delivering healthcare have to acknowledge the role that organizations have played over time and today in perpetuating um, the the mistrust of healthcare as a system because of the actions of the healthcare organizations, the way that things are systemically baked into medicine. And that's, you know, one of the things that I in the course that I'm teaching. This is one of the things that I'm trying to help to instill even in the beginning as people are entering into medical school. But it goes beyond just acknowledging what that role is, and requires that the healthcare organizations and the clinicians and health workers be able to step into the community and say, we're going to work with you. We're not going to come and preach at you and tell you what to do, that's what's best for you, because we feel like it's best for you. We're going to have conversations, and then we're going to talk about how best we can work together to be able to move through the pandemic and the rest of the issues that we have. So an example for that is when we were looking at vaccine rollout in Omaha, the it was rolling out the same way it was rolling out everywhere else, with starting off with elderly individuals and not really taking into consideration those who were most vulnerable and impacted by COVID-19 being from Black and Brown communities, and the fact that the average age of the people from Black and Brown communities, of those who were dying from COVID, was much younger than those who were in the white community. And so a group of us, we saw that was happening, and as healthcare workers reached out to the community members, and we formed a collaborative together where we pulled in the health department and said, we want to have more vaccine clinics in our predominantly Black communities. And this is not a negotiation. This is us telling you, we want to have it, and you need to give us vaccines on this day. And it was really fascinating to me to be a part of that conversation, because we went very quickly from all of the barriers that were preventing us from equitably rolling out vaccines in the community to, okay, you've got a vaccine clinic on March 27th. And then we just did it together. And those are the sort of things that really need to happen more organically, with support from the funders, from the healthcare organizations, from the folks who have the resources and the money to be able to support the community, because the community wants to get this done, just don't have a lot of the resources to do it.
And how did the community respond when you mobilized vaccines?
People
and you're
showed
in Nebraska,
up.
Right?
Yeah, I'm in Nebraska. I'm in Omaha. People showed up, and we had we went from that particular initiative. We went from March 27th to May 16th, and we vaccinated over 2,600 people, and over time, the number of people that were showing up to vaccine clinics went down, and what that was showing us was this model that we started off with, where we were in one place and asked people to come to us, that wasn't working anymore. And so then we reconnected, we talked about it, and then we started putting more resources into pop-up clinics and driving to where people were and going into communities. A couple weeks ago, we just had a community in a predominantly Southeast Asian refugee immigrant community that didn't have a lot of folks vaccinated. We set up shop in the parking lot in between the two apartment complexes, and people came out and got vaccinated. And so it's a matter of really going in and talking to folks and giving them the information that they need, and answering the questions, taking as much time as needed, And for me personally, what I enjoy the most is just being there, especially for those who are a little bit afraid. I have a fear of needles, and so before I got my own
A
vaccine,
doctor who's
I
afraid of
yep,
needles.
I do not. I get my flu shot every year. I get all my shots, but it always takes me a while to work up to actually go in to get them. And I was the same for the COVID vaccine, and I will admit that on the day that I was meant to get my first dose, I sat in my car and for about 20 minutes was freaking out a little bit and almost turned back my car on and went back home. And I had to call one of my
Wow.
friends to talk to me and like talk me down. And I finally went and got it. But now I do the same for other people who show up at these vaccine clinics and they're nervous and they don't like needles or they're afraid of, that last step. And I hold their hands and I walk right with them so that I can, answer their questions and just be a support for them.
Was your concern about the needle or about the COVID-19 vaccine?
So I don't like needles, period. I'm not
So
very
you're
good at
more
getting
afraid
my
of the
blood
needle than the
drawn.
vaccine.
Yeah, I will admit though, I mean, I got my vaccine back in December. And while I was working myself up about the needle, because I hadn't seen it before and I didn't know that it was a really small needle that wasn't actually going to cause me any trouble. Um, I had all of these things that I was making up in my head about what the shot was actually going to be like. But I did think a lot about what people have gone through and why folks have questions and why folks might be concerned and why it was important for me to do my own personal research, meaning I needed to listen to the experts that were around me who were doing the clinical trials because I did not participate or run a clinical trial, so I needed to read that data and I needed to make sure that I understood what the vaccine was about and be able to explain to other people about that. And once I was able to do that, and I talked to my folks in Dominica about getting the vaccine, I felt like I was very comfortable not only to get it, but to talk to people about why they should be getting it too.
Yeah, thank you so much for being human. People forget just because we're doctors, they think we're not human. We have the same issues, concerns, fears as other people. So I appreciate you sharing that with everyone.
Yeah.
So before we go, I just want to give you both an opportunity. Let's leave this sort of on a high note. What's brought you joy during the pandemic or when you're down? Like, what do you do to sort of pick yourself up? Tiffany?
Who's goes?
Okay, I'll go. So there are a couple things I've really gotten into crafting, like needlework, cross stitch. There was one other taking all the like little online classes, online music streaming things, and then also I'm part of a reading tribe called Lit Love Journey, and we've picked some really great reads over the last 18 months. So being able to connect monthly with those ladies has been like phenomenal.
What was the best book you read in your Lit Love journey?
The best book that we read.
I know I'm putting you on the spot. I'm good for that.
No, it's okay. I'm trying to be quick on my feet. So I think it was The Yellow House by Sarah Broome. She's a new author. She is from New Orleans. And the book is about her personal experience coming back to New Orleans after Hurricane Katrina.
Right on. And
I'm
what
just
about
writing
you,
that down.
Dr. Jasmine? What about you?
So reading has been a thing for me too. My sisters and I share the books that we read every month with each other, and we don't do a whole lot of discussion, but we like to be able to compare notes. And so that's been something that has really been a pick-me-up. And I read anything from young adult to I pre-read a lot of my children. I have a 9-year-old, and I pre-read a lot of his books because he reads above his reading level, and so I just want to make sure that those books are all right. And so I read a lot of fantasy and fiction. I also like to read memoirs. And the other thing for me, honestly, has just been engaging in the community. Every time I go out to a vaccine clinic, I come back so energized. Just even if it's a clinic that we don't vaccinate a lot of people, just having the conversations with folks and being out in the community brings me a lot of joy and a lot of energy. So I will always keep doing that.
Do you have a story you can tell us from those vaccination clinics? Maybe leave us with some inspiration, something that happened at one of those clinics that stayed
Yes.
with you.
So there was one particular clinic that we had. We set it up on Juneteenth Day at one of these events that was happening in town. And we didn't have a lot of traffic through that particular clinic, but there was an individual who was kind of hanging around the clinic area. And I was having conversations with them, and they had so many questions that were really a lot of the misinformation and misconceptions that are out there. And that was really energizing for me because it was just an opportunity to not have an argument, but to just answer every single one of them. Let's talk about microchips. Let's talk about side effects. Let's talk about long-term effects. Let's talk about the speed. And we just did all of that. And then when I finished my shift, they hadn't decided that he was going to get the vaccine. And I was just kind of like, well, I really enjoyed that conversation, even though that person was much different from me, fundamentally in so many different ways. And then I got a text later that evening that person did get their vaccine. And
Right
so
on.
that was just, that made me really happy.
Yeah, well, we definitely need to add you to our Ask the Doctor tribe. So stay tuned for more on that. But thank you all both so much for being here today and joining us for this community conversation. And for those of you who are watching this video, if you're not a subscriber to Grapevine, please don't forget to hit the subscribe button for more community conversations. We'll be talking to people who are just like you and me, getting their perspectives on not just the pandemic, but why it's hard to be healthy, or what we can do, how we can learn from each other when it comes to health and keeping ourselves healthy. So thanks again, ladies, and we'll see everybody later.
Thank you.
Thank you.